In America, after age 70, the biggest threat to seniors isn't aging. It's unnecessary medical testing. Today we'll explore why experts say that more testing doesn't always mean better health, and how smart screening, not excessive screening, leads to a longer, calmer, happier life. Section 1. Understanding the reality of aging is not a straight line, it is a curve. The human body after age 70 does not behave the same way it does at 40, 50, or even 60. In the United States alone, nearly 34 million people are over the age of 70. As the population grows older, something new has emerged, a silent trend where seniors undergo more tests than they actually need. But why does this happen? Because the American healthcare system is built on two powerful ideas. 1. Early detection saves lives. 2. More data means better care. These beliefs are valid. Screening tests do save millions of lives. However, after a certain age, the human body undergoes such drastic biological changes that test results become harder to interpret. False positives increase significantly. Medical procedures become riskier. Treatment may cause more harm than benefit. Doctors who specialize in senior health, called geriatricians, understand this deeply. They don't believe in less care. They believe in smart care. Section 2. Why more testing does not always equal more health. America has some of the most advanced medical testing technologies in the world. From blood panels to scans, imaging, digital diagnostics, and genetic testing, the options are endless. But here's something surprising. After age 70, the usefulness of many tests naturally decreases. Why? Because most medical tests were originally designed and validated on adults between 25 and 60 people with faster recovery ability, bodies with typical immune responses. Once a person crosses 70, three major biological shifts happen. 1. The immune system weakens, meaning small inflammations or harmless abnormalities appear on tests, but they may not represent disease. 2. Recovery becomes slower. Even simple follow-up procedures become more stressful. 3. Body systems show natural age-related changes, which can look like abnormal results even when nothing dangerous is happening. This leads to a problem called overdiagnosis. Overdiagnosis means finding something that would never have caused harm, but once discovered, it leads to stress, further testing, anxiety, and unnecessary treatments. Section 3. The hidden emotional cost of testing. For seniors, tests don't only mean money or effort, they mean stress. In the USA, stress is a major factor affecting senior health. Studies show that older adults experience anxiety before results, confusion about medical terms, fear of follow-ups, emotional exhaustion, sleep problems. Imagine a 72-year-old man waiting for the results of a test he didn't even need. He spends days worrying. What if something is wrong? What if this changes everything? What if I need surgery? Even when the result comes back normal, the emotional toll remains. Doctors understand this emotional burden deeply. That's why modern geriatric care encourages testing with purpose, not testing out of habit. Section 4. The physical risks of unnecessary testing. Not all tests are harmless. Some involve radiation exposure, contrast dyes, sedation, biopsies, invasive tools. After age 70, the body becomes more sensitive to these. 1. Radiation. Older cells are weaker and repair slowly. Even small amounts of radiation can cause fatigue or inflammation. 2. Contrast dyes, used in many scans. These can stress the kidneys, which naturally weaken with age. Biopsies. A tiny tissue sample for a younger adult can be a big ordeal for a senior. Follow-up procedures. Many tests lead to more tests, creating a chain reaction. Doctors don't avoid tests because they're dangerous, they avoid unnecessary risk. Section 5. The concept of life expectancy and quality of life. Healthcare for seniors focuses on two major questions. 1. Will this, as we age, maintaining good health becomes a priority? Doctors often recommend regular checkups and tests to catch diseases early and manage health better. But did you know that after the age of 70, some medical tests may no longer be necessary or even harmful? Why should certain tests be stopped after 70? Medical experts caution that routine screening tests, which are useful for younger adults, may not provide benefits for seniors over 70. Instead, these tests can lead to unnecessary stress, invasive procedures, and even risks that outweigh the benefits. Common tests. Doctors suggest stopping after 70. 1. Routine cancer screenings, like mammograms and PSA tests. For women over 70 with no symptoms, continuing mammograms might cause more harm than good due to false positives and unnecessary biopsies. For men, PSA tests for prostate cancer may detect slow-growing cancers that will not affect their lifespan, leading to overtreatment. 2. Cholesterol testing. After 70, cholesterol levels don't always predict heart risk accurately. Focusing on lifestyle and managing symptoms is often more effective. 3. Bone density scans. If you've had normal bone density scans in the past, repeating them frequently after 70 is usually unnecessary. 4. Routine blood sugar testing. In absence of diabetes symptoms, frequent testing may not be needed. Risks of unnecessary testing. False positives. Tests can show abnormal results that aren't harmful but cause worry and more tests. Overdiagnosis. Finding and treating conditions that wouldn't affect quality or length of life. Invasive procedures. Follow-up biopsies, surgeries, or treatments that have side effects. Stress and anxiety. Constant testing can increase mental burden. What should seniors do instead? Focus on overall health and quality of life, rather than chasing numbers. Maintain a balanced diet, stay active, and manage chronic diseases with your doctor. Discuss with your healthcare provider which tests are truly necessary based on your individual health, family history, and current symptoms. Regular checkups focusing on physical and mental well-being are important. Conclusion. Age should change how we approach healthcare, not stop it altogether. Stopping some routine tests after 70 can protect you from unnecessary procedures and stress. Always have an open conversation with your doctor about the benefits and risks of any test. Remember, the goal is smart, personalized care, not just more tests. Your health and comfort matter most. As we step into our golden years, it's crucial to shift our focus from chasing every possible test to embracing thoughtful, personalized healthcare. After 70, more tests don't always mean better health. In fact, unnecessary screenings can sometimes lead to more harm than good. The real goal should be to enhance your quality of life, manage existing conditions wisely, and preserve your peace of mind. Healthcare is not just about numbers and reports. It's about how you feel, how you live, and how you enjoy every moment with your loved ones. So listen to your body, trust your doctor, but also trust yourself to make choices that honor your age, your health, and your happiness. Because at the end of the day, the best care is the care that respects you, your journey, your comfort, and your right to live well. If you like this video, please like, subscribe, and share.